But I couldn't walk up a hill without getting an angina pain 12 months ago.
17 years ago, Colin Wilson was diagnosed with angina, a narrowing of the arteries in the chest, serious enough that his doctor considered operating. Normally, to get round here, you'd have to have 5 tablets in a day when you're playing golf. How many tablets are you taking now?
None. So it was 5 a day on a golf day, 3 a day on a normal day, and now none at all, whatever. And you can see I've just played 18 holes and I'm hardly puffing and no angina.
The 69-year-old says he owes his newfound life to complementary medicine after years of getting nowhere with conventional treatments.
I was very sceptical when I was first approached about this from a friend of mine who'd been going for 12 months before I had, but he'd had success with a cancer problem, so I decided to go along, and in fact in 10 months I've gone off taking 2 lots of medication.
Colin is one of many thousands of Australians who have explored and benefited from alternative treatments. In fact, almost 60% of Australians currently use complementary medicine. This remarkable change of attitude has emerged not only among everyday people, but also among doctors and scientists.
There is a large groundswell of people out there in the community who are demanding better treatment, softer therapies, therapies that are effective, therapies that are safer than many of the therapies that orthodox doctors are using.
Dr Ian Brighthope is one of the ever-increasing band of doctors who feel that complementary therapies should be integrated into orthodox medicine.
Yes, we spend over $50 billion a year on disease care delivery in this country. The World Health Organization has estimated that 20 billion of that, 40 or 50 billion, is being spent on diseases that are preventable, lifestyle diseases. Very little in terms of lifestyle disease care is delivered by orthodox doctors.
But while community acceptance is gaining momentum, the main body of medical opinion is still frowning upon the trend. Some see it as a professional jealousy, that the medical profession feel threatened by the alternative practitioners.
I don't really think that the practitioners feel threatened by alternative practitioners. Unfortunately, there's a lot of illness in the community, and I think that the issue is we're concerned about the health of patients who may be taking alternative and unproven medication. We're concerned about the fact that people may go to an alternative practitioner who hasn't got the ability or the training to diagnose, and we're concerned that they then may be either misdiagnosed or undiagnosed and not be diagnosed and adequately treated for some time.
AMA Queensland spokesperson Dr Dana Wainwright says there's still a long way to go before complementary therapies are accepted by mainstream medicine.
And anecdotes don't constitute evidence. Traditional use doesn't constitute evidence. I'm quite sure many of the herbs do many wonderful things, but we have no proof that this is what they do, and it's going to be a long road before we know that indeed this is what they do.
In the minds of many Australians, complementary therapies are the answer. And tonight we look at what is arguably the most popular, traditional Chinese medicine. Herbs, acupuncture, meridian massage and qigong are the 4 main strands of TCM. Qigong is the oldest, combining special movements, meditation and breathing. It's been used by the Chinese to restore balance and vitality for more than 8,000 years. It's used to cure both chronic illnesses and life-threatening diseases, and is the fastest growing exercise system in the world, with 250 million people using it daily.
Qigong has been such a powerful source of traditional Chinese culture, and particularly in the areas of creating Chinese medicine. And so it has been widely used as a part of the medical system in Chinese hospitals.
Dr. Jirong Zhang has a long history in traditional medicine. He spent his childhood watching and learning from his father and grandfather.
You follow the master practitioners of Chinese medicine, or you have your family tradition, your father or your uncle been the practitioner for many years, or even carried that for hundreds of years of generations. That's the way that I was trained. Since the age of 7, my family had about over 350 years of history in traditional Chinese medicine, in Tai Chi, and in Qigong.
Probably the leader in the popularity stakes, though, would have to be acupuncture, with a growing number of orthodox GPs now learning the art. It's the only alternative medical procedure you can officially claim on Medicare, with over $17 million being paid out in the last year.
Here we have a patient, David. He had some digestive system disorder with a pain in the knee. So we're going to do some acupuncture on him now. The point we point out, it's a point called Zhu Ni. It's called 3 miles from the knee. So you put your fingers like that, that's where the point is.
Acupuncture is based on an entirely different concept from that of Western medicine. Health and well-being are believed to be maintained by a balance of energies within the body.
So the needle is inserted in very quickly and then slowly turning in up and down, up and down. And the idea of that is trying to get the sensation of qi. The idea of the manipulation is to either increase the energy or decrease the energy flow. So in that cases, and the case is it's a low energy in the stomach, so we would have to increase the energy flow.
Meridian massage also has a long history dating back to 3,000 years BC. It works on creating balance, relaxation and stimulation.
We've gone through from the neck up to the back, upper back, then we move to low back. This covers the function of heart circulation, lungs capacity, with the liver and the spleen. Also end up with a kidney point. In Chinese herbal medicine, you very rarely use one single herbal. It's always a formula which comes for harmony and balance together.
Dr. Zhang says herbs can treat a wide range of conditions, from chronic shoulder, back and neck pain to hypertension and even some forms of cancer. However, he stresses herbs are powerful and in some cases toxic, so should be treated with respect.
Each herb is combined, they have different effects too. So in the formula of 12 different herbs, you must know precisely what target you're using and what area of complaint you're targeting for. Otherwise, you could make a chaotic situation comes out.
Colin Wilson can now spend his days doing what he loves most. A regime of Qigong and herbs were his winning combination, allowing him the luxury of his daily round of golf without the crippling effects of angina. Would you ever have considered 5 or 10 years ago that you would be coming to a traditional Chinese medicine doctor?
Very unlikely. My own doctor never suggested that I should go and see somebody else. And when I told him that I was coming to this one, he said, well, you know, my advice is to keep going.